Now we're gonna start the communication skills. Communication skills, the main purpose of the communication skills stations, they wanna test how you approach difficult situation and how you communicate with your patient. Altogether, communication skills has more than 80 marks for the clinical skills. And there's two stations that are purely communication skills. You will enter a preparatory station which will be empty, and there will be a file and a paper in which you will take your note, and then you're going to go to the next station. The next station could be phone call or in person, and we divided it here to phone calls and in person, as you can see. Same way the exam. There will be a medical examiner, and there will be a person just to judge your body language and your sympathy and empathy with the patient. Okay, let's practice. First one, splenic hematoma. Scenario: you are a surgical doctor asked to discuss the case of middle-aged man patient who has sustained fracture ribs and a subcapsular splenic hematoma. Despite being hemodynamically stable, the patient hemoglobin has fallen from 10 to 9, which is significant, indicating potential ongoing bleeding. The patient, Mr. Anderson, has expressed a desire to leave the hospital. Your role is to communicate effectively with Mr. Anderson, ensuring he understands the gravity of his condition and the risk associated with leaving against medical advice. We gave you here a general idea about how to approach this station. Firstly, start by introducing yourself as the surgical doctor responsible for Mr. Anderson's care. Use clear and empathetic communication to explain Mr. Anderson's condition and the importance of remaining in the hospital, because your main goal is to keep him in the hospital because it's not safe for him to go now. Address Mr. Anderson's concern and reasons for wanting to leave while emphasizing the potential consequence. Ensure Mr. Anderson understands his condition, the risk of leaving, and his responsibility if he chooses to self-discharge. Provide reassurance, even though if you want to self-discharge, you still need to provide reassurance, support, and guidance, offering assistance in addressing any practical concern Mr. Anderson may have. Hello, Mr. Anderson, because you already know the patient name. I'm Dr. Smith, one of the surgical doctors. I understand you are considering leaving the hospital, but before you make that decision, I would like to discuss your case with you. Tell me, Mr. Anderson, what do you know about your diagnosis? By asking him this question, basically you are taking a permission for him in a different way. Say, I would like to discuss your case with you. Tell me, Mr. Anderson, what do you know about your diagnosis? He may say, please doctor, don't talk to me, and that's mean he declined. Or he may say, not much doctor, I'm tired of being here, I want to leave. Okay. I completely understand your frustration, Mr. Anderson. However, hospital stays are only recommended when necessary for your health and safety. You have splenic hematoma. What is splenic hematoma? Immediately the patient asks, what is splenic hematoma? Spleen is an organ on your left side of belly. Hematoma is a collection of blood, simply. I can draw it for you. Draw for the patient. This will make you appear professional. You already have your paper and your pen. If you can draw to the patient, that would be much appreciated. And what you're going to draw? You're going to draw just an abdomen, and on the left side, create an organ. Call it spleen. Okay, so just simple drawing will help. I understand now. So the patient understands. But he has problems. My wife has a colon cancer, doctor. I need to take care of her. How are you going to approach this one? I'm really sorry to hear that. So you have to be sympathetic with the patient. That's the main purpose. And I understand your situation, but your health must come first. We can arrange support for your wife while you focus on recovery. Okay, so you address the first point. What about my job interview? That's another obstacle. I understand that the job interview is crucial for you, but your health is paramount or important. We can explore job opportunities once you are in a stable condition. So you'll give him another choice. Or you can say, we can explore job opportunities once you are in a stable condition. Or I can ask for your interview to be delayed. That's also another option. I'm not convinced, doctor. I want to leave right now. And just I want you to remember, in this communication station, there's no right or wrong answer. It's a diplomatic questions. And always prepare yourself for new questions for a challenging patient. Mr. Anderson, can you repeat what we've discussed about your condition? You just want to make sure he understands. Yes, I have a splenic hematoma or whatever. You advised me to stay, but I want to leave anyway. Alright, so that's very clear communication from him. As I cannot discharge you medically, that's what you're going to say. As I cannot discharge you medically, you need to sign a legal document acknowledging the risk of leaving against medical advice. Okay, I will sign it. So he's very determined to leave. Before you leave, please, if you experience any worsening symptoms, call 999. They may ask you to come to the hospital or may send an ambulance to get you. So even though the patient is discharging himself against medical advice, you still also need to take care of his safety. Summarize the discussion and offer ongoing support. At the end, Mr. Jason, you've decided to self-discharge, understanding the risk involved. If you feel dizzy or weak or experience abdominal pain or if there is any worsening of your symptoms, you must contact 999 as an emergency or get to the hospital immediately. Of course, he will not drive to the hospital. It will be with help of one of his relatives. We're here to support you and my contact information will be provided to you for any question or concern. Thank you for cooperation. And at the end, probably you may find 2-3 minutes. In these 2-3 minutes, try to summarize your discussion with your patient, even though if the examiner didn't ask you to do so. Next station is counseling for OGD dilatation. Scenario: you are tasked with counseling a patient who has dysphagia and is scheduled for an esophageal gastroduodenoscopy OGD procedure. The patient is holding tissue due to excessive salivation. Your role is to explain the procedure, address the patient concern, discuss potential risk, and obtain consent. What to do? We try to break it down so you will have better idea. Introduce yourself as the surgical doctor responsible for counseling the patient. Use clear and empathetic communication to explain the OGD procedure, including its purpose and what it entails. Address the patient concern and question regarding pain, risk, and potential outcome. Offer reassurance and support. Emphasize the importance of procedure for diagnosis and treatment. Obtain informed consent from the patient to the procedure. Hello, Mr. Mo. I'm Seth, one of the surgical doctor. I'm here to explain to you an investigation we would like to arrange for you. Can I ask, what do you know so far about this? Always ask your patient, what does he or she know so far about the operation? That will give you the baseline. Not much, doctor, and expect this answer from your patient. Okay, let me explain. This is called an esophagogastroduodenoscopy or OGD. A flexible tube will be inserted through your mouth, down your food pipe. And look, we didn't say esophagus. Why? Because we are not using medical term. Into your stomach, along the first part of your small bowel. This image is captured by camera, will be displayed on a TV screen so we can examine the inside of your digestive tract. Additionally, we will widen any narrow areas in your food pipe that were identified during the barium swallow, and we may also take tissue sample for further analysis. As you can see, we just use layman language. Okay, understand now. Is it painful? Now your patient is concerning about pain. This procedure is typically performed under sedation, which will make you slightly drowsy and ensure you feel no pain. So the main purpose of the analgesia is to make sure the patient doesn't feel any pain. Are there any risks? As with any medical procedure, there are potential risks involved. That's going to be your answer. This may include damage to your teeth, infections such as chest infection, bleeding from the sides, where tissue samples are taken, and in rare cases, the There is a risk of accidentally cutting through the wall of your food pipe, which is perforation. You don't say perforation or esophageal rupture. You explain in layman terms, as we said here. There is a risk of accidentally cutting through the wall of your food pipe, which may require surgical repair. I don't want to proceed with this risky procedure, doctor. So your patient is like nervous now. Imagine you telling your patient there's a risk of you rupturing your food pipe. That's a big risk. I understand your concern and always change your tone. But listing this risk doesn't mean they will necessarily occur. It's important to undergo this investigation as it's crucial for determining your condition. Rest assured, only skilled and experienced surgeon will perform the procedure. So make sure you deliver 2 points. The first point is that mentioning the risk factor doesn't mean the risk factor will happen. It's very important to mention to your patient. The second point is reassure your patient that the procedure will be done by experienced surgeons. Why am salivating so much, doctor? The excessive salivation is likely due to the narrowing in your food pipe, which disturbs the normal flow of saliva downward. Is it cancer? That's another concern. It's too early to confirm that. We will need to wait for the result of this investigation, and depending on the result, further tests may be necessary to determine the cause. The results usually take about 2 weeks to come back, and I will make sure to contact you as soon as they are available. Do I have to stay in the hospital? Typically, you will be discharged home once you fully gain consciousness, which usually takes about 2 to 4 hours. However, you won't be able to drive yourself home, so you will need someone to accompany you. And this is a very tiny detail, but if you mentioned it, that's going to be very professional of you. Are you happy to sign the consent form? So, if your patient is not, let's say you finish this sentence, accompany you, and your patient is silent now. What you're going to do? You're going to encourage your patient to finish the consultation. And how you're going to finish the consultation? By making sure the patient is signing. You came here just for the consent form, right? And to reassure your patient. Yes, doctor. So your patient is consenting. To summarize, and usually you will find time to summarize. Always summarize. To summarize, Mr. Mo, you agreed to proceed with the OGD. This will be performed under sedation, and I have explained the possible risk and the importance of the procedure. We are here to help you and support you throughout this process. If you have any question or concern, please do not hesitate to contact me. Thank you for your understanding. Next station is an anxious and guilty woman, appendicitis. Scenario: a 14-year-old girl with acute appendicitis is brought to the hospital by neighbor. The mother who is at work becomes anxious upon realizing that the surgeon, Mr. Lee, is the same one who operated on her husband, who later passed away due to the colon cancer. What you need to do: answer Miss Anna's questions and reassure Miss Anna. Hello, Miss Anna. I'm Dr. Lucidia, one of the surgical doctors. Can we talk about your child condition? Yes, doctor. So she gave you the permission. Don't forget the consent. Can you please share what you know about your child condition so far? And here you also assess the baseline of your patient. Miss Anna: I feel guilty. I work for long hours, and so far I don't know about my daughter. So you need to reassure your patient. First, don't feel guilty. This could happen to anyone. That's a very kind sentence. Your daughter was brought by a neighbor complaining of tummy pain. Initial investigation suggests acute appendicitis. She is being managed by one of our doctors and received intravenous fluid and antibiotics. Now we are waiting for the consultant to operate. Are you sure it's acute appendicitis? That's a question probably you will be asked. We suspect it due to common signs and symptoms, but we can confirm only after the operation. So you are not confirming the acute appendicitis. Is it dangerous? And that's a fair question. In children, it can be. Less fat inside the belly makes rupture particularly dangerous. You don't say omentum. You say less fat inside the belly. Just use the layman language. But let me reassure you that only skilled and experienced surgeons are allowed to perform such operation. Will the wound be disfiguring? A small horizontal wound may leave a scar, but we might need to expand it, which could be disfiguring. Or lance incision will not be disfiguring. But if you needed to expand it for whatever reason, then it's going to be disfiguring. What other problems could occur? Severe infection might block reproductive tube in young girls, potentially causing future subfertility. And as you notice here, subfertility is a medical term. You need to explain it. She can't get pregnant in the future. Don't worry, she has another working tube on the other side. I'm not saying she will be infertile. What I'm saying, there is a possibility of subfertility, which means more difficulty in getting pregnant. So you need to explain the subfertility. Mr. Lee did an operation for my husband and he died. Sorry to hear that. May I ask when and how he died? So when she tells you that her husband died, don't immediately jump to defend your consultant. No, that's wrong move. You should always be sympathetic. I'm really sorry to hear that. May I ask when and how he died? He had colon cancer and died few weeks after the operation at home. So she misunderstood what's going on, right? You need to explain to her. I'm sorry to hear that again, but you also need to give her the reality. Those are two different situations. Your husband likely died from cancer, not the surgery. Mr. Lee is one of the best surgeons we have. So you defend your consultant, but after you reassure your patient and you clarify the point to the patient and you communicate very well. Can I see her? Of course, let me check and arrange it for you. Let's summarize. And now you will have like 2-3 minutes. Always summarize. Let's summarize. Your child has acute appendicitis. We are waiting for consultant to operate. I've explained the risk and the benefit. We are here to help you and support you. Feel free to contact me anytime. Thank you. Thank you. Always at the end, when you have 2-3 minutes, always summarize. Even though if the examiner didn't ask for it, always summarize. Next station, preoperative anticoagulation counseling station. Scenario: an elderly gentleman, visually impaired and wearing dark glasses, lives independently despite having undergone mitral valve replacement surgery and battling colon cancer. He is currently taking warfarin and is scheduled for recurrent hernia surgery. Hello, Mr. Khalid. I'm Dr. Chad, one of the surgical doctors here. I understand you have some concern about stopping your warfarin pills. Could you share more about your apprehension? My doctor told me that I shouldn't stop it because stopping would threaten my life. So he has a good point here. You need to argue this point and explain to your patient. I understand your concern. Let me explain. Warfarin thins the blood to prevent clot formation. However, before your hernia surgery, we need to stop warfarin to prevent excessive bleeding. Instead, we will give you a short-acting injectable drug called heparin to maintain the blood thinning effect during the surgery. So we will not allow you to clot because we're gonna change your medication to another one. Why don't you continue my warfarin instead of heparin, which is a very valid point. How can you argue this point? That's a good question, Mr. Khalid. Both drugs thin the blood effectively, but warfarin effects last longer, while heparin effects wear off sooner, allowing us to stop it closer to your surgery. When can I resume warfarin? After surgery, once we are sure there is no excessive bleeding, we will start warfarin alongside heparin until blood tests confirm warfarin effectiveness. Is it necessary to stay in the hospital before operation? I'm glad you asked. Yes, you will need to stay about 5 days before surgery for monitoring during transition from warfarin to heparin, because you wanna transition your patient from warfarin to heparin. You will give him heparin infusion and you will measure the response using ABTT. Do I need to stop my anti-anxiety medication before the operation, doctor? You should continue diazepam until the morning of surgery with just a sip of water. So he will have his medication in the morning with a sip of water. Thank God, I really need these pills. When you reach the end, as we said, even if the examiner didn't ask you, always summarize. So, to summarize, you will stop warfarin 5 days before surgery. You will receive heparin until just before the surgery, and then resume warfarin after surgery once it's safe. We are here to support you through this process. Feel free to contact me anytime. Thank you for understanding. Thanks, doctor, for taking the time to explain to me. Next station, anxious mother counseling station. Hello, Miss Sarah. I'm Dr. Lily, one of the surgical doctor. First, could you please share with me what you already know about what happened? Are you already asking questions? No, doctor. I'm the one who needs answers. Now tell me what happened. So your patient is very angry and you need to absorb her anger. Miss Sarah, your child fell off his climbing frame and seriously injured himself. We did a belly scan. Look, we said belly scan, we didn't say CT scan. We did a belly scan and immediately took him to the theater. I apologize that you couldn't see him before being taken to the theater, but it was an emergency and we couldn't delay the treatment. How did he get the injury? His father informed us that he was playing in the garden when he fell from the tree. Oh my God! His drunk and abusive dad, you mean? So she's very upset about the dad. I'm sorry for what happened. That's all what you can say. I'm sorry for what happened. You mentioned you did a scan. What is the result of the scan? Unfortunately, the scan indicated that he has a ruptured spleen and he is currently undergoing surgery to address this issue. What do you mean exactly by a spleen? So don't wait for your patient to ask you what do you mean exactly by a spleen. Answer this question before he or she asks. Immediately when you finish your previous sentence, you should say, and I want to tell you about the spleen. The spleen is an organ located in the upper left side of the abdomen. It plays a role in the body defense mechanism against microbes. And I will draw it for you here. And you bring your paper and draw it for your patient. Is it a serious condition? A ruptured spleen is indeed a serious condition. That's why your child was taken urgently to the theater. Be very honest and transparent. He's in a good and experienced hands, but his condition remains serious and may affect his life. But his father is drunk and I want to protect my son. Could you help me? That's a very valid point. In situations like yours, we take extra precaution to ensure your child's safety. We will conduct a standard procedure and involve a child protection consultant to ensure that your child's best interests are safeguarded. Will my son require any medication after the operation? If his spleen is removed, he will need vaccination to protect against potential infection and may require lifelong protective antibiotic, but minimum of 1 to 3 years. So you don't give a direct answer. You tell her it's minimum to 1 to 3 years, but he may need antibiotic for lifelong. How long could the operation last? When can I see him? Be diplomatic. It's difficult to determine the exact duration of the operation. You can see him as soon as he comes out of the operation room. When can I take him back home? Also be diplomatic here. Our priority is your child's medical care. We will ensure he makes a good recovery and won't discharge him until a full clinical examination is conducted and his GP is informed about any concern. And at the end, you're just gonna summarize as usual. To summarize, your child, Miss Sarah, fell from a tree as per his dad and has a ruptured spleen. He's being operated on by experienced hands and you can see him as soon as he leaves the operation room. We're here to support you and if you have any question, please don't hesitate to contact me.